No one is better at embarrassing Donald Trump than Donald Trump, and he did it tonight with the Australian Prime Minister, whose name he could not remember.
I shouldn't say this to our great gentleman and my friend from Australia, because you have better health care than we do.
And the president is right. Australia does have better health care than we do because they have universal coverage. And today, House Republicans voted to make American health care coverage much, much worse. We saw something today that we've never seen before. A baseball team ran out on the field and started celebrating victory and making speeches and congratulating each other because it was the end of the first inning and they were ahead by 1 run. That's what happened in the White House Rose Garden today. Something we've never seen before. A few dozen members of the House of Representatives going up to the White House for a public celebration of the passage of a bill in the House of Representatives only. We have never, ever seen that before. Members of Congress do not go up to the White House to celebrate the passage of a bill until the bill is ready to be signed by the president. In other words, until it's passed the House and the Senate. The bill signing at the White House is the first and the last celebration of a bill at the White House. The Republicans have so little confidence that there will ever be a bill signing at the White House that they decided to have their big celebration today at the end of the first inning. The bill that passed the House today now goes to the Senate. The Senate is absolutely not going to pass the bill that the House just passed.
Is there any chance for an up or down vote in the Senate on the bill as written to get it quickly passed and move quickly past the issue for Republicans?
No.
Zero.
I mean, no.
I love talking.
Look, it's just, that's not the way it's going to work.
If some kind of Obamacare repeal and replace bill does get through the Senate, the Senate bill, would then have to go through a third stage. A conference committee made up of members of House and Senate would then get together and combine the two House bills, the House bill, the Senate bill, combine those two, produce a brand new third bill. And then that third bill would have to then pass the House of Representatives again, and then pass in identical form through the United States Senate without changing one word. Now, many bills don't make it through all of those stages. Many bills pass the House, never pass the Senate, just die in the Senate. Some bills pass the House, they pass the Senate, and then they die in that conference committee. And so tonight, the likelihood is that Paul Ryan was right the first time when he failed to get a vote on his bill in the House.
I don't know what else to say other than Obamacare is the law of the land. It's going to remain the law of the land until it's replaced.
In the Rose Garden today, 12 Republicans spoke. Only one of them made a specific promise about what this bill would do.
Yes, premiums will be coming down. Yes, deductibles will be coming down.
And of course, that's not true. If this bill ever did become law, none of that would happen. But this, this was the biggest lie Donald Trump told today.
We will have great health care for everyone in our nation.
No, we won't. We do not now. We don't have universal coverage now, and we're going to have less coverage if that bill ever became law. No other Republican was foolish enough to make such a ridiculous statement. That bill needed 216 votes to pass the House. It got 217. And the reason Paul Ryan insisted on 217 is that he didn't want Democrats to be able to accuse 216 Republicans of casting the deciding vote. And he thinks that mathematical trick of adding one more vote to the total actually immunizes 216 Republicans from being accused of casting the deciding vote. Tell that to these people. Republicans did something that they promised not to do.
I don't think we should pass bills that we haven't read, that we don't know what they cost.
they have no idea how much this bill costs. They did not wait for an estimate from the Congressional Budget Office. Without a CBO score of this bill, you don't know what you're voting on. Republicans have no idea what they just voted on. And one reason that they could do that is that they don't expect it to become law. They don't expect to ever have to live with the results of the vote that they cast today. Here's Republican Tom Garrett giving Stephanie Ruhle a very honest answer to the question of, have you even read the bill?
Have you read the whole bill?
Oh, gosh. Let's put it this way. People in my office have read all the parts of the bill. I don't think any individual has read the whole bill, but that's why we have staff.
And that's true. Most members of Congress, most senators never read any bills. That is why they have staff. And that is why most of them hate that question.
Congressman, have you read the bill yet?
Yes.
Thank you for the question. Good morning, gentlemen. Have you read this bill, Congressman? Congressman, have you read the bill?
No, we're in a hurry. We'll be back.
Mr. Goodlatte, have you read the bill that you're voting on today? Did you read the bill? Have you had a chance to read the bill?
I'm finishing reading it this morning.
You going to vote on it before reading it?
Absolutely not.
As reported here last night, many Democrats, especially in the leadership of Congress, were happy to see the bill pass the House of Representatives today, as long as it does not pass the Senate, because they believe the 217 votes that this bill got are the best weapon that they have against Republicans in the 2018 congressional elections. And so when the bill passed, the House Democrats could not resist singing goodbye to the Republican members who they hoped to defeat because of the vote that they cast today. Joining us now, Dr. Nitin Donnelly, former president of the American College of Physicians. Also with us, John Heilman, co-author of Game Change and executive producer and co-host of The Circus on Showtime. And Charlie Sykes, editor-in-chief of Right Wisconsin and an MSNBC contributor. Dr. Donnelly, I wanted to get your reaction first as to what you see in this bill that passed the House of Representatives today and what it would mean if it became law.
Well, thank you for having me on, Lawrence. So let me first say that the Affordable Care Act did something remarkable. It brought our insurance rates down to the lowest level we've ever seen in history at 8%. This bill would reverse those changes, reverse those improvements in health insurance that we've seen over the past several years. Number one, what it would do is it would eviscerate Medicaid. It would result in approximately a 25% cut in Medicare funding. So those states that adopted Medicaid would be defunded, and there wouldn't be any further expansion. That would mean that millions of people, up to 14 million people who are on Medicaid, would be without insurance. And these are people that we see in our office with chronic conditions. They're elderly, they're poor, and they're sick, and they need good health care. Number two, what it would do is put a large number of people into these pre-existing conditions pools, insurance pools. And we know that 23% of people in the United States have a pre-existing condition. And these folks would be in a pool that would be very expensive, would offer some limited coverage, and would have long wait times to get service. And number three, what this bill also does is it allows states to opt out of essential benefits as simple as maternity care or hospital care or emergency room care or substance abuse care. And these are really important benefits for our patients going forward. And finally, what the bill does that's also rather egregious is that it separates out people who are older from people who are poorer in terms of the amount of in terms of the rate of insurance that they have to pay, up to 5 times more for older folks versus younger folks. So, for example, someone who's 64 years old and makes $26,000 a year could end up paying $14,000 a year in health insurance. Now, I don't think that $2,000 or $4,000 tax credits towards that $14,000 really helps too much. So we really think that this is a flawed bill, and it's a bill that does tremendous harm. And we have a principle in medicine that is, first, we do no harm, and we think this bill does tremendous harm. So we hope that once it gets to the Senate, that the Senate will really just look at the ACA and say, let's improve on the Affordable Care Act and not act on the AHCA.
John Heilemann, one of the most interesting political phenomenon of the day was that there were some so-called moderate Republicans who were opposed to a more moderate, more generous version of this bill, who then voted for this crueler version, just to use the shorthand. I'm going to try out my theory on you about why they did that and what the closing argument would be on that. And it would be all about tax cuts, meaning we won't be able to move on to our so-called tax reform bill, which is really just a giant tax cut bill. We can't do that until we get the bookkeeping done on this Obamacare stuff. We've got to repeal all those taxes in Obamacare. We've got to cut all that spending in Obamacare so that we can apply that spending savings to our big tax cut package as we move down the road. And so you, Mr. Republican moderate congressman, will never be able to vote on our big tax cut unless you vote on this first stage of the tax cut in Obamacare. And by the way, the Senate might never pass this health care thing, and you won't have to live with the results.
Lawrence, I'm going to say the two words that I know you like better than any other. You are right. Actually, that's three words, right? You're right.
I'll take it. I don't care how many words it is.
Yeah. I mean,
you have the floor, John Heilemann. Take your time.
I will say I've been making this argument, and others have been making this argument for several weeks now, that this is the driving force behind the reviving the push to get this bill through the House. After Donald Trump said, when the bill collapsed the first time, we're moving on. He said, we're moving on, we're going to go do tax reform. And they looked up and said, you know what? It's not that easy. Trump was ready to cut and run and just get on to the next thing, but getting on to the next thing for reasons both of politics and actuarial matters in the House requires getting this done. And so the tax reform push is what's behind this, I think, largely. The other thing, and I've talked to a lot of moderate members and other members in the House who were going through this process last week and now this week in the whipping process, there was one other simpler thing, not just the tax cut dynamic, but also just the simple words, we've got to win one for the team. And you heard that was just the message that was being delivered over and over again to these moderate members, and eventually they decided to capitulate on that front. I'll have to say, though, that is a very short-sighted view of what winning means, and I think this almost defines the notion of a Pyrrhic victory, what they managed to register today.
Well, Charlie, the clear message that they believe this is a win is that they had a victory celebration. Yeah. They had a victory celebration at the end of the first inning of the legislative game. And we've never seen that before. I said when I saw this, I immediately asked everyone, please check, when is the last time the House went up and celebrated just House passage of a bill? No one could find that it had ever happened before.
You know, I think one of the, I think it was a Republican congressman from Kentucky who said that this bill was sort of like passing a kidney stone, and the House just wanted to get it out. They didn't really care what it was. But you know what an extraordinary moment for conservatives, because conservatives not only used to believe in small government, but they also used to believe in prudence. They used to understand that the people in Washington should be very cautious and modest when tinkering with 1/6 of the economy. And really what they did today, and I think you're absolutely right when you said that they really don't know what they did. I mean, literally, I don't think they know what they did in terms of the cost or the impact on the public. It's sort of like taking off in an airplane full of passengers without checking to see whether you have all the fluids and whether the brakes in fact work. You know, and so next week you're going to get the Congressional Budget Office scoring, but a lot of those congressmen have to live with the consequences of what they voted for. And you know, that soundbite from Paul Ryan is you know, I got to say that gets me, because, you know, I'm a conservative commentator, a supporter of Paul Ryan. I'm old enough to remember back when every Republican in America would have said what Paul Ryan was saying, what Lindsey Graham said today. You find out what's in the bill before you pass the bill, especially when you have such high stakes, not just politically, but in terms of people's lives, in terms of life and death.
John, I think Charlie was pretty much sure when Paul Ryan became Speaker, you would not see the House of Representatives vote on a bill with no CBO score. I think a lot of people were sure of that.
Right.
This was the day they did it.
Yeah, look, I mean, and as Charlie remembers, you know, this was a point of mockery that Republicans, the Republicans mocked Democrats over and over again in the passage of the Affordable Care Act for not having read the bill. And of course, Paul Ryan has been a devotee, a fetishistic devotee of the CBO for decades in Washington, D.C. The idea that he's throwing over the importance of numbers, the importance of scoring, just casting all of that to the wind, it's so fundamentally at odds with what Paul Ryan has stood for such a long time. And Lawrence, I will say one thing, there is no analogy that I know of where members of the House have gone up to the White House and celebrated a bill for just passing it through the lower chamber. But there is, I think, a parallel here, and I'm thinking about May of 2003 when George W. Bush stood on that aircraft carrier in front of that sign that said "Mission Accomplished" in Iraq, and he rued that day for for years thereafter as the Iraq War turned into the disaster it turned into, declaring victory early on something really big like the Iraq War or repealing the Affordable Care Act is a very, very dangerous thing to do politically. Those pictures from today will be in a lot of ads in 2018 and maybe in 2020.
Yes. Dr. Donnelly, let me just ask you, if you got the 30 seconds on the Senate elevator in the Capitol going up 3 floors with a senator, you just had that one moment to talk to a senator, a Republican senator, about this, what would you tell that senator?
Well, number one is that you do need to get a CBO score. I mean, you cannot pass any bill without a CBO score. But number two is that, you know, this is irresponsible. It really affects our patients. I mean, these are patients' lives that are at stake. These patients have chronic conditions. They can get cancer and not be properly covered. They can go bankrupt. What we need to do is to improve the Affordable Care Act so that there are things that can be better handled. The market can be better handled. Coverage can be improved, but not through the AHCA.
We have to take a break here. Dr. Nitin Donnelly, John Heilman, Charlie Sykes, thank you all for joining us on this important night. Really appreciate it.
Thanks, Lawrence.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.